Today we are celebrating the 12th annual Women's Health Day in Louisiana. This is also commemorating National Women's Health Week.
What is the biggest issues facing women's health?
Right now, some of the biggest issues are maternal and infant mortality. We have an alarming rate of maternal and infant deaths in this state, and especially among black women and black babies. We also have a lot of concern about mental health and maternal mental health. Maternal mental health is one of the leading causes of the maternal mortality. We're also concerned about issues around access to health care. With the Medicaid unwind, we have approximately 500,000 Louisiana residents who have lost their health insurance, who have been disenrolled from the Medicaid program. This is causing a reverberating effect also on access to health care, also on the provider community. Providers are starting to have layoffs because their numbers are dropping in terms of their patients. And so we're seeing the impact of that coming down the pipe as well. So we have, those are just a few chronic diseases and illnesses. I mean, we could go down the list, but those are the few of the major issues that we are concerned about here today.
Now I'm going to read our proclamation. Jeff Landry, Governor. Whereas, proclamation. National Women's Health Week, NWHW, is strategically positioned in the middle of Women's Health Awareness Month and beginning fittingly on Mother's Day, extends from May 12th through 18th, 2024. And whereas women from all walks of life and at every stage of life have unique health needs that should be addressed promptly and with the best medical attention available, and whereas the partnerships with social, health, and other related services help keep women healthy and safe by promoting awareness of women's health issues, and whereas in 2023, American Health Rankings ranked Louisiana 37th in the nation for overall clinical care for women and 42nd for maternal mortality. Whereas in Louisiana, as well as nationwide, heart disease remains the leading cause of death for women, and something as simple as walking at least 30 minutes a day, 6 days per week, can reduce our risk of dying from heart attack by 50%. And whereas cancer is the second leading cause of death for women in Louisiana and the nation, and by receiving regular mammograms and clinical breast exams, we can save women's lives and provide early treatment against this horrible disease when it's detected. And whereas Women's Health Week also encourages women not to neglect their mental health, such as managing stress to ward off anxiety and depression. Whereas, with this year's theme of healthy women, healthy families, healthy communities, women's health remains a priority for families, communities, and government, and our commitment to keeping women in Louisiana healthy and strong. I, Jeff Landry, Governor of the state of Louisiana, do hereby proclaim May 20th through the 18th, 2024 as National Women's Health Week in the state of Louisiana. And this is the proclamation.
Today is not just any ordinary gathering. It's a powerful testament to our collective commitment to support and advance women's health and advocate for women's health. As we delve into this crucial discussion, and you're going to hear from some phenomenal speakers this afternoon, I urge you to immerse yourselves fully in the significance of our cause. Let's start by confronting a stark reality, and you heard some of it in the proclamation itself. Louisiana grapples with one of the highest maternal mortality rates in the United States. Is that news to anyone? Did anyone not know that? The numbers speak volumes. 39 deaths per 100,000 live births in 2023 alone, a figure that surpasses the national average. That's per 100,000 live births in 2023. 13 out of 15 occurred among Black women. This isn't just a statistic. It's really a call to action. It's a glaring indication of the systemic inequalities that plague our healthcare system. We cannot turn a blind eye to the root causes behind these disparities. Structural racism and the resulting barriers to adequate care disproportionately affect marginalized communities. Women in maternal care deserts face even heightened risk during pregnancy and childbirth, which amplifies the urgency of our work and our mission. Yet, amidst these challenges, there is hope. There is hope. Over 80% of maternal mortalities in the United States are preventable. So most of those deaths were preventable deaths. A staggering realization that underscores the importance of our advocacy efforts. That is why we are here, because we can save lives. Most of those lives could have been saved. It is time to turn the tide, to champion policy changes that prioritize maternal health and well-being. And we have asked this administration, the Governor Jeff Landry administration, to make maternal and infant mortality a priority. Paid maternity leave, a living wage, accessible child care, these are not just lofty ideals, but they're tangible steps towards saving lives. The establishment of the office, the newly formed Office on Women's Health and Community Health, marks a pivotal moment in our journey. And the Assistant Secretary is here. You will hear from her shortly. And we're looking forward to hearing from Ms. Womack. This office really stands as a beacon of hope, a catalyst for change in women's health outcomes. And Louisiana is one of a very few, handful of states that have a state office within state government on women's health. That's something to celebrate, y'all. Come on. But we cannot effectuate change in isolation. We cannot do this in silos and working you know, alone in our respective spheres. It really requires collaboration. Multi-sectoral collaboration is the bedrock upon which our success rests. By fostering interdisciplinary partnerships and engaging with marginalized voices for collective action, we can dismantle entrenched barriers and we can pave the way for a brighter future for all women. Enter LA 40 by 2030. LA 40 by 2030 is our bold vision to improve the health outcomes and quality of life for children and families over this decade. And women's health is one of the four key pillars of LA 40 by 2030. If we are truly to improve the health outcomes in Louisiana and to move from where we are now at the bottom, 50th, last in the nation, we are going to have to improve the health of our women, the women in this state. So we have developed the LA 40 by 2030 Data and Action Health Equity Platform, which is a tool designed to track key health indicators and to galvanize collective action for our bold vision. And many of you, several of you here in this room today have already become and are a part of that journey with the Data and Action Platform and the work that we are doing through that platform, the collective action work that we're doing. And I want to publicly say right now, thank you for being trailblazers, because you're at the forefront. You are trailblazers in this work. Through this collective action work, we are breaking down silos. We are furthering collaboration and collective action, and we're driving towards tangible progress in health outcomes. Today, I implore each and every one of you to seize this moment. And I'm going to say that again, to seize this moment. Connect with someone new, someone that you didn't know. We want to raise our horizons, lift our horizons, have a broader view, a bigger vision for our state. It is unacceptable to be last. How do you feel about being last? Not good. So we need to have brighter horizons, look towards a brighter future, and really work towards that brighter future. Together, we possess the power to affect real change. If we want to see change, we are the change. We must become the change that we want to see. Together, again, we possess the power to affect real change, to rewrite the narrative of women's health in Louisiana. We don't have to be last, y'all. We don't have to have among the highest infant and maternal mortality in the nation. We can rewrite that narrative. And today we are here to talk about how we can rewrite the narrative. So as you depart from this gathering, in case you don't hear from me again today, which is probably unlikely, carry with you a renewed sense of purpose. You're not here by accident. We're glad you're here, and we want you to leave feeling empowered and feeling connected and feeling challenged to become a part of this journey. If you're not already a part of it, become a part of this journey. We need you. Louisiana needs you. Our mothers and babies, our children and families need you. Let us harness the full effect of our collective strength and solidarity as we strive towards a future where every woman receives the care and support she deserves. And that is not happening in our state. Thank you once again for your unwavering dedication and commitment. Together, let's build a healthier, more equitable Louisiana for all. Enjoy the rest of the meeting.
I'm honored to share in this time with you meant to educate and empower the women of Louisiana. By taking on the role of Assistant Secretary, I am committed to advancing the well-being and equity of the women of our state in all facets of life. Before we dive into the insightful panel discussion they have planned for you guys, I'd like to provide you with an update of the office and highlight women's health priorities of the Louisiana Department of Health. Established by Act 676 of the 22 regular legislative session, the Office of Women's Health is charged with leading and coordinating the Department of Health efforts to improve women's health outcomes through policy, education, evidence-based practices, programs, and services. With that in mind, I'd like to share the mission and vision of our agency, which encapsulates the values and aspirations that drive our collective efforts toward a brighter and healthier future. Our mission is clear: to empower women and communities across Louisiana to make informed decisions regarding their health care. We are dedicated to addressing health disparities, improving access to quality care, and fostering a culture of wellness that places women's health at the forefront. Our vision extends beyond the confines of our present state. We envision a future for the state of Louisiana where every woman receives exceptional health care and every community is health conscious and empowered to take charge of their well-being. Last year, our agency conducted a comprehensive town hall series to gather the community feedback and understand the diverse needs of the women across our state. The Listen to Her Town Hall series, her meaning hearing, empowering, and responding. It spanned all 9 regions of Louisiana, which included New Orleans, Baton Rouge, Houma, Lafayette, Lake Charles, Pineville, Shreveport, West Monroe, and Hammond. The Office of Women's Health collaborated with regional medical directors, legislators, local community partners, higher educational institutions, and local constituents to organize these events. The team used 2 tools to collect data: the Women's Health Needs Survey and through roundtable discussions. The Women's Health Needs Survey was adapted from a study from the Louisiana Women's Policy and Research Commission. It comprised 24 multiple choice questions and 2 short answer questions, covering topics such as personal well-being, financial status, healthcare access, education, family relationships, and other top health concerns. The roundtable discussion featured questions like, share community success or failure that you have observed. What actions can the community take to address these challenges? What potential obstacles might arise? And what values should guide our approach to assist? The next 2 slides will outline key findings from the participants' responses to the Individual Health Needs Survey. So the survey questions were categorized into the key areas reflecting overall health needs that were listed on the previous slide, this being the first, and continuing over to the second. I'd like to highlight concerns regarding access to care, limited access to mental health services, and challenges related to obtaining affordable health insurance. The office identified 4 focal points for roundtable discussions based on the findings of the state health assessment conducted between 2021 and 2022. Community members identified behavioral health, community safety, social determinants of health, and maternal and child health as priority areas during the state health assessment community engagement process. The subsequent slides will highlight the predominant concerns raised within each of these key areas. Behavioral health concerns emphasize the necessity for community-based health services and improved access to mental health facilities and providers. Addressing the needs of aging individuals and caregivers, as well as implementing trauma-informed, healing-informed, and restorative practices were scored as crucial needs. Community safety concerns pertaining to health emphasize the importance of faith-based interventions, cultural appropriate mental health care, and availability of domestic violence resources and reporting mechanisms. Maternal health concerns highlighted the need for improved adolescent health education, peer support systems, and enhanced access to reproductive health care. Participants also stressed the importance of increasing affordability and availability of services such as doulas and midwives, particularly in our underserved communities. The social determinants of health underscore the importance of community-based health services, enhanced access to health facilities and providers, and improved counseling services. Across the diverse range of concerns highlighted in the presentation, several common themes emerged: access and affordability, cultural competency, prevention and education, and the last being community engagement and support. In response to insights gathered from the town halls, in Region 4, they've taken strides to combat food insecurity by establishing a coalition to address local challenges and ensure access to affordable and healthy foods. Region 7 is focusing efforts on adolescent health, particularly through faith-based initiatives. Regions 6, 7, and 8 have united in a community action team to confront maternal health disparities and organize impactful community events. LDH has taken strides at expanding the availability of mental health providers across our state. Recognizing the need for accessible resources, the Office of Women's Health website will soon feature an asset map, connecting women of all ages to vital community services statewide. Office of Women's Health will also be actively engaging with regional representatives throughout this summer to assist in any ongoing initiatives. So as Ms. Alma said, Louisiana's maternal mortality rate exceeds the national average and is also increasing at a rate exceeding that of the United States. The Office of Women's Health and LDH program offices are steadfast in our commitment to improving maternal health outcomes in Louisiana. We're firm in our efforts to implement effective measures that address maternal mortality and morbidity. Together, we pledge to work diligently towards ensuring safer pregnancies, childbirths, and postpartum experiences for every woman in our state. Research conducted by the department revealed 4 critical factors that negatively contribute to maternal and infant mortality and morbidity. Those 4 factors are lack of care coordination, substance use disorder or accidental overdose, maternal care deserts and workforce shortages, as well as congenital syphilis. LDH has formed an internal maternal health priorities work group, and we are actively developing policies to tackle these challenges head-on. Collaborating with Louisiana Medicaid and the Bureau of Family Health, the Office of Women's Health is actively pursuing funding through the CMS Transforming Maternal Health Model, also known as TEMA. The TEMA initiative will play a pivotal role in educating both members and providers, offering vital technical assistance to revolutionize maternal care. This support is essential in transforming how we approach pregnancy, childbirth, and postpartum care, ensuring that all stakeholders are equipped with the knowledge and resources needed to deliver comprehensive, person-centered services. Our department remains steadfast in our commitment to prioritizing initiatives that bolster access to maternal care and foster early intervention in chronic disease. We're propelled by the urgent need to ensure that every woman and child in Louisiana receive the comprehensive health care that they need. Your support and collaboration are crucial as we navigate this journey. We deeply appreciate your time and welcome any opportunities to join forces. Together, we can forge a brighter, healthier future for the Louisiana women and children. Thank you all.
Good afternoon. My name is Mara Richardson, and I serve as the Chief Development Officer for the Louisiana Chamber of Commerce Foundation. My background is in economic development, but I started my professional journey actually in advocacy. When Alton Sterling was murdered in 2016, me and my peers were leading the marches at that time. So all of the work that I do, regardless of if it's in the healthcare space or the economic development space, it will be rooted in making sure that Black people are centered in that work, because I think we are the ones who are impacted by it.
Good afternoon. My name is Michonne Sadiq. I am Deputy Director at New Orleans Health Department, also founder of Her Institute. My area of expertise is maternal and child health. I am a certified lactation counselor, a hypnobirthing practitioner, and a doula. So I'm happy to be here.
Good afternoon, everyone. My name is Michelle Easton. I am a registered pharmacist. I am the owner of a consulting firm called Custom Made Consulting. I have a residency in psychiatric pharmacy. I'm a mental health first aid trainer, and I am very much passionate about health equity.
Hi everyone, I'm Andrea Gallo. I'm a reporter for The Advocate and Times-Picayune, covering the whole state of Louisiana. And I spent most of last year reporting on infant mortality and maternal mortality and why Louisiana struggles so greatly with these issues. So I'm happy to be here with all of you today.
My name is Eugene Collins. I'm the former president of the NAACP here in Baton Rouge. My background is in public health. I spent over a decade working for the Louisiana Department of Health and Hospitals before I went over to the NAACP. But more recently, when I stepped down, I put more of a focus on being an advocate around women's health. That's because of 4 years ago now, we lost my baby sister, my nephew, who was our childbirth. So I kind of making sure that my family and we kind of spread that message to bring some awareness.
All right, so this first question, Andrea, you could probably hold the mic because this one's right up your alley. So what trends surrounding maternal health and mental health are being discovered through journalism?
Yeah, great question. So we decided last year that everybody kind of knew Louisiana had these terrible rates of infant and maternal mortality, but it seemed like it had kind of become part of the background or the wallpaper, like people weren't alarmed by it, and we thought we really wanted to kind of wake people up and show just how devastating this is and what an effect it has on our population. So we took a look at the data from the CDC, and we ended up finding out that infants in Louisiana are 65% more likely to die from being born preterm or low birth weight compared to infants in the rest of the country. And that was horribly concerning. And we wrote stories about families who had been through these sorts of losses. And basically, it's such an expansive topic, but we have looked at access to healthcare. We've looked at problems in the state's Medicaid program. We've looked at how the opioid crisis is contributing to these outcomes and what can be done about that. We've looked at solutions that other states have found. And nationally, I think we've seen a lot of journalists, a lot of reporters really focus on maternal mortality in the past couple of years. I think it's become kind of increasingly popular to see it written about. So hopefully all of the attention will lead to better outcomes.
And we're going to kind of expand on that. Maybe Eugene, you can jump in based off of your personal experience. Drawing from your professional expertise and lived experience, what do you feel are the most significant issues affecting maternal and infant health? What do you think should be done to improve maternal and infant health?
Well, one thing that I'm excited to see is the Office of Women's Health finally up and rolling, right? I know Dr. Alma Stewart, that's something that she pushed for a very, very long time. Even when I was still in public health, Dr. Alma was talking about the Office of Women's Health, right? And I think that's so important to think about how women are treated when they get to the hospital. And I'll say 100%, my sister and my nephew aren't here today simply because of how they were treated once she got to the hospital. The hospital even tried to send her back home. My mom had to tell her to go back to the hospital, right? And I often think, like, if my mom had told her to go back, we probably wouldn't have had the extra few days we had with her. But they didn't treat my sister like they would have treated their sister. And that's the big issue is that when folks show up at that desk, you're supposed to treat them like you would your family member. You know, when I was working in public health, the most important person in the clinic or in the hospital was the receptionist. How you greeted people at the front desk, that dictated the experience from now on. If the receptionist was hard when they got the practitioner Mandrell, she had a hot mess on her hands. That's just what it is. But when my sister got to that reception area, they didn't fully listen to her. They didn't take into account the things that she was saying. So they said it a lot. She said I had a stroke. But if they just would have opened their ears, opened their hearts, and not just for a second thought that, hey, this just ain't a job for me, right? This is a little bit deeper. I'm gonna go a little bit farther, caring for this person as a human, like I would my sibling. My sister probably is still sitting here today, because it was just a matter of not getting to her quick enough, right? And when you think about that, it angers me, because I wasn't educated. As the president of the NAACP at the time, Ms. Gallo knows we were engaged in a lot of things with maternal and child health. Wasn't one of them. Wasn't something on our radar, right? Because I never thought about in 2024, my sister could walk into a hospital and be treated less than human in this country. You didn't think that was possible. So it wasn't something that I think that the layman or the folks that's outside of the work that y'all do every day even thought about. And sometimes I felt horrible because it wasn't something I even thought about until I walked in my living room, my family had to deal with it. And I just often think about it, the people that tried to turn her away at the hospital that they knew a lot. My mom's a daughter. She's a very good student, very great student, great volleyball player, excelling up there at Southern Lab. Had to stay home this morning because after Mother's Day, it's just been rough for her. I wanted they knew her, right? I wanted they knew my nephew, Jace, who held on for days longer than he should have, right? If anybody asks me, I always tell them Jace was the strongest fighter in our family. And Collins family is a clan, right? We're a very strong family, very tight-knit group. You mess with one of us, you better get ready to fight. But I often wonder if they knew Jace, right? I often wonder if they knew every other sister who still struggles. I wonder if they knew Eugene Collins Sr., who still can't keep pictures of my sister in his house. I just wonder if they understand the far-reaching effects that when you don't care, that's what we're dealing with, folks that just don't care enough. When you don't care enough, how far that reaches and how many people it affects. My baby sister forever changed my life from her deathbed. Last time I saw her, she told me everything gonna be all right. And for years, I was upset. I was mad about that because my sister was a godly person. She was connected, right? She was the one that could call everybody in the family, get everybody together, right? And those of y'all who know me, I see my good friend A.V. and Myra, who I was working with for years, and Ms. Gallo sitting beside me. I can be a bit of an asshole at times, right? My baby sister was one of the few people that could call me and check me, right? Because I knew she meant well, I knew she was connected to something different. Not having that, it's been different. It's been way different. And for years I was upset because I knew how connected she was, and she told me everything was gonna be all right. it took me a while to understand that she was telling me everything was gonna be all right. But I left the hospital that night, came back to Baton Rouge, and I was just getting pulled up in my driveway. I got a call from my dad that I needed to come back to the hospital. My baby sister wasn't gonna make it. And I remember thinking, like, she went there with a simple issue. She's had a good pregnancy, like there was nothing wrong. Like, what are you talking about? I was in disbelief. I had to sit there and collect myself about 30 minutes in my driveway before I drove back. Like, what do you mean just ain't gonna make it? And it was never a thought about mine. But it was all because people just didn't care enough to ask a few more questions or to hear her out. And let's just be real, that's how this country's always treated black women. They think, bitch, I don't hurt as much. That's a historical fact. You have to trust me to Google it. And because of that, I truly believe my sister's not sitting here today. I apologize about what over my time.
So we're going to kind of stick to this. I'm going to toss this one over to you, Michonne, talking about resources and what you do. What is a certified birth doula, and how do they support birthing people and their partners through pregnancy and labor? And what does it mean in a situation where you need to be heard or you need that extra care?
Thank you for that question. So I want to just clear up is in this country, there are different types of doulas, and there's no national accrediting board. So I'm a part of the Louisiana doula registry, so we try to get away from the term certified. So I am a trained doula. So a doula is an emotional and physical support person for a family during the birthing process. So a doula will go with the family during the prenatal appointments. They'll go to the family in the home and do an assessment. They're not nurses, they're not doctors, so and they're trained that we understand what our scope of practice is. When we talk to the family about what their needs, we understand their medical condition, and so when we see signs of anything going wrong, we will advocate for that family to go to the hospital. And I say family because we're not just there for the mother, we're there for the entire family to support them during that process. So in the hospital, what it looks like, they'll stay there for the entire birthing process. So the family will call, we'll often meet them at the home, help them with comfort measures, go to the hospital. And then when people are not treating them right, we advocate on their behalf. So we know what high blood pressure looks like, and we know what those things are. But if a woman or a birthing person is not being treated fairly, then we're going to advocate for them and stay with them throughout the process and make sure that the doctor knows there are other signs. Like, I hear you asked about blood pressure, but when I was in her home, we talked about the headaches that she's been having. We've been talking about the swelling. I went to her house a couple of weeks ago and I saw this going on. So we'll advocate, so all of those things, those other questions will be asked and that we will advocate. So after the birthing process, we also are with the families during the postpartum. Some doulas do 1, some do 2. And so that postpartum visit is checking for signs of depression, checking for if everything's going right in the home, doing things like cooking for a family, changing the diaper, holding the baby while mother and father might take a nap, cleaning up, whatever that might look like for that particular family. So we are there to advocate, we are there to support, and be there throughout the entire period from prenatal up until maybe 1 or 2 months after the baby is born.
And let me ask this quick question. What does access to a doula look like? Is it something that everybody can get? Is it affordable?
So in Louisiana, so we are making strides. So usually it's more like the people that are well off would get it. But we, as a part of the Louisiana Doula Registry Board, have been advocating for that for a few years. So now in Louisiana, there is a bill that provides coverage for families who have insurance. And Medicaid, some of the care plans actually reimburse doulas or provide coverage for doulas, but it's not state law, and so that's one of the laws that we're advocating for this session, so that Medicaid recipients and third-party insurers also will cover doulas.
Thank you. You can pass it over to Myra now, since we are speaking about access. Thank you for that. So drawing from your professional expertise and lived experience, what do you feel are the most significant issues affecting women's access to health care? What do you think should be done to improve women's access to health care?
This morning, we actually had a roundtable conversation for Mayor Sharon Weston-Brown, and she met with 40 healthcare providers, and I wish she could be in here to explain and hear more about what everybody said. I didn't know any of this dude stuff, so if you didn't know that, raise your hand. I didn't know none of that. I'm just shook. I'm like, okay, I want to take this home. But in the conversation, when we were talking about access, from my personal perspective, and I always bring the story up in this setting, is my great-grandmother, she had lupus. And she was 30 years old, and it paralyzed her for the rest of her life, and she would never walk again. Then there would be my grandmother. She would have lupus because it's hereditary, and she would be able to work. She would have spots, and it would cause her pain, but it was manageable, right? There was an introduction of medicine. It was a little bit more preventative. And then my mother, she manages it well. She was able to detect it early on. And try to, go around some of the things that my grandmother and my great-grandmother experienced. And now with me, I can't afford to be stressed out, right? I don't have the privilege to be stressed enough to spike a lupus flare. I don't want to experience the things that I have seen my family endure because they went through those things, so I didn't have to, for me to be able to go take care and manage my own care. But when we talked about access today, one of the things a lot of the nurses said in that conversation was that there has been a decline in the way we do health literacy. That a lot of the preventable things that happen in our community are happening at a higher rate post-COVID because of the lack of connectivity, right? The lack of not knowing your neighbor, the lack of what we prioritize to our children. I remember going to hundreds of health fairs when I was a kid. I was like, man, how many times are they gonna tell us how to do CPR? I was wondering. And now that is not the priority for our children. I look at all of the times where we go into our community and we might see some of the same faces and conversations like this, but when we go to Walmart, how many of those people do we really know? Could you say, oh, I heard your grandma stumble a little bit when she was bringing those groceries out the car. Did you help her? Yeah. We don't have those conversations anymore, and that goes back to that health literacy component and just that interpersonal connection. Eugene can call me and say, Myra, I ain't seen you going to events for a couple of weeks. What's going on? And know that I've been at home and I'm not coming. I don't want to go to that event. But the reality of just being able to check on each other and to have those real conversations. So I think access is a very real conversation that we need to be having, and especially through the lens of health literacy, not just for ourselves, but for our children. When I look at this room and I think about who is missing, it's those kids, right? There's a lot of times we can't teach old dogs new tricks, but we could be doing a lot for these children who need to be having these conversations and be a part of this. And Alma has done a wonderful job. Where's her granddaughter? She in the back? Well, her granddaughter, I went to, I'm the same age as her granddaughter, and she's in this space, picking up the baton. How many of us are passing the baton to say that this conversation goes beyond what we're doing in this room? So I think access is an intergenerational conversation. I think it's something that we have to live through the educational lens. And I think that the second thing that I heard a lot of the healthcare providers were talking about is that oftentimes people would go to the nurse they knew, not the doctor they go to. That they would go to the person they feel comfortable having that healthcare related conversation with, not just who was prescribing the medicine to them. And a lot of the times those people were private care providers. These people were not associated with a lot of our larger network providers. And oftentimes they had struggled with getting reimbursements to even serve these people. So they would spend an hour with a patient and not see $1. And that's unsustainable for these businesses who are really and truly serving our community. So for me, I think it's a financial thing, and I think where you spend your dollars is a moral guide to what you care about. So when we analyze these budgets from the state legislature on down, where you're spending your dollars, is it on health literacy in 7805, 7802? Or is it just on O'Neill? Where is it going? So for me, I think it boils down to access. I think it boils down to relationships and communication, and then ultimately dollars. That makes sense.
That was going to be my next question, affordability, but you handled it. So we're going to tap in Michelle for this one. With the next question, we'd like to hone in on a particular issue of concern. Over the last year, because of Medicaid unwind, millions of people have lost health insurance coverage. I think it's over 50,000 here in the state of Louisiana. What injustices because of effects of Medicaid disenrollment have you witnessed, and what response do you think this warrants? Obviously, this is something we need to talk about.
Yeah, I guess I would say that we really need to look at the vulnerable populations, right? Our elderly and our children, particularly when we talk about the Medicaid unwind, right? So because of COVID, more people were enrolled, had more access to health care, very positive, helpful thing. Unwinding it because the pandemic is, because COVID is over, the pandemic is no longer quote unquote, in play. And so persons may lose eligibility that otherwise would still be on Medicaid, right? And so we have to really look at what are the messages that are coming to persons in terms of how they can keep their coverage, right, if they are still eligible. So I think that the unwind situation is a delicate one, and it's one in which we should be screaming up and down about healthcare is a right, right? It's not an extra, a nice to have, it's a need to have, right? And so we have to recognize that when we are doing, rolling things back, that there are real people who are going to be harmed potentially by that. And so the Medicaid unwind, while it's a necessity and every state does it differently, it is important to remember that these are actual individual people, that it's more economic to keep people healthy by giving them access to care than to taking people off, not having the care and getting more sick. Health disparities widen, and all those things happen when people are uninsured.
Hi, my name is Frankie Robertson, and I'm so honored to be here today to be a part of this symposium, and I am deeply honored to have been asked by Ms. Alma to recognize Ms. Margaret Weatherspoon Collins with this recognition, only a small token of our gratitude for all that you do, all you have done, and certainly all that you have endured. And I ask that you please come up to the front. Last year, State Senator Regina Barrow authored a bill that passed. It was Act 207, and it was named the Jessica Collins Ruffin Act. And this was 100% a result of Ms. Weatherspoon Collins and her family and loved ones' effort to raise awareness of the tragic, terrible loss of their loved one, daughter, and friend. And Senator Barrow could not be here right now. She is at the Capitol, but her heart is here, as you know, and it always will be. And I'm deeply touched and honored to be the messenger here today, certainly wishing that there was no need for a messenger to be here today at all costs, but thanking Ms. Weatherspoon Collins, Eugene, and their family for making sure that the memory and legacy of Jessica and Jace both live on through not only their work and their activism, but everyone here today. So if you could please stand me in recognizing Ms. Weatherspoon Collins and thanking her for everything that she has done and continues to do, not only for her family, but really for the entire community. Thank you.
Before I start singing this song, I have to give God all the glory and all the honor for not just me being here, but for all of us. In the midst of your struggle, whatever you're going through, give it to God. Do what you can and give the rest to God. Who opens doors that I cannot see? Jesus will. Jesus will. Who will make all my decisions for me? Jesus will. Jesus will. Yeah. When I'm in trouble, when I'm in trouble, He gives me a song in the night season, in the night season, and all the day long. Who makes me do right? Who makes me trouble, He gives me a song in the night season, and all the day long, who makes me do right when I would do wrong. Jesus will. Jesus will. Thank you.
Ladies and gentlemen, esteemed guests and advocates of the well-being of Louisiana families, together as we commemorate and gather for Women's Health Day, we embark on a journey that intersects with a bold initiative, the journey that has led us to the Office of Women's Health, fueled by LA 40 by 2030, a transformative vision to improve the health and well-being of Louisianians by the year 2030. In these next 3 minutes that I have, let us unite in purpose, weaving the threads of women's health into the fabric of this visionary campaign. The health of our women is not just a matter of individual well-being, it is integral to the success of LA 40 by 2030. As we strive to uplift our communities and build a healthier Louisiana, we must recognize that the empowerment of women is central to our collective progress. Let us seize this moment to reaffirm our commitment to the health and vitality of every woman in our state. From New Orleans to Shreveport, from Baton Rouge to Lake Charles, let us stand in solidarity, advocating for the policies and programs that prioritize women's health and well-being. Access to health care is a cornerstone of women's health, and it is imperative that we break down barriers and ensure that every woman in Louisiana has access to quality care. Whether it's routine screenings, prenatal care, or access to mental health services, let us strive for equity in all of those areas, leaving no woman behind. Education is our greatest tool in the fight for a healthier Louisiana woman. Let us empower women with knowledge, equipping them with the information they need to make informed decisions, to make sure that their bodies are healthy. Let them be aware of reproductive health, to chronic disease prevention, and let us foster a culture of education and awareness that empowers women to take control of their health. But our commitment to women's health extends beyond the confines of the clinic or the hospital. We must also address social determinants of health, the economic, social, and environmental factors that hinders and blocks us. Let us work towards economic empowerment, access to education, safe living conditions, recognizing that the health of women is intertwined in the health of our communities. Let us pledge to be agents of change, to campaign and champion the cause of women's health, to advocate for policies that prioritize the well-being of women, and to create a future where women in Louisiana will thrive. LA 40 by 2030 is more than just a goal, it's a promise to build a healthier, more equitable Louisiana for generations like my little Jim back there that should be recording me, for all of our generations to come. Together, let us rise to the challenge, knowing that the power to shape the future lies within each of us. The time for action is now, and the journey ahead may be long, but together we can achieve this vision of a healthier Louisiana for all. So thank you all for your time. Thank you for Ms. Alma.
What needs to happen at the state level is that there needs to be an investment in the newly formed Office on Women's Health that was created and established in 2023. That office is charged with, by legislation, that office's purpose that it was created for is to address these kinds of women's health outcomes, to improve the health and quality of life for women across the state of Louisiana. So investing in that office, ensuring that that office fulfills its purpose and its mission is really, really vital to addressing these concerns.
How can people get more information?
People can get more information by contacting us through our website, which is www.lahealthequity.org, Louisiana Center for Health Equity, lahealthequity.org.